What are the best treatments for macular degeneration vision? Imagine a world where your central vision gradually blurs, making everyday tasks like reading or recognizing faces more difficult. That's what happens with macular degeneration, a common eye condition affecting millions worldwide. While there is no cure yet, understanding current treatments can help you manage the disease and preserve your sight. The treatment options mainly depend on whether you have dry or wet macular degeneration. Dry macular degeneration is more common and progresses slowly. Currently, the focus is on slowing its advancement rather than reversing damage. Nutritional supplements based on the age-related eye disease study are often recommended. These include vitamin C and E, zinc, copper, lutein, and zeaxanthin. They may help slow the progression in people with intermediate or advanced dry AMD but do not restore lost vision. For wet macular degeneration, which involves abnormal blood vessel growth that leaks fluid or blood behind the retina, the most effective treatment is antivascular endothelial growth factor injections. These drugs, such as ranibizumab, aflibercept, and bevacizumab, are administered directly into the eye by a specialist. They work by blocking the growth of new, fragile blood vessels and reducing leakage. Regular injections are usually needed, often every 4 to 8 weeks, to control the disease. Many patients experience stabilization or even improvement in their vision with this treatment. In some cases, photodynamic therapy may be used. This involves injecting a light-sensitive drug that accumulates in abnormal vessels. A special low-power laser then activates the drug to destroy these vessels. Photodynamic therapy is less common but can be helpful in specific situations. Laser therapy itself, which uses high-energy beams to target abnormal vessels, is less frequently used today because of risks like scarring and further vision loss, but it remains an option when other treatments aren't suitable. Recent advances have introduced new drugs aimed at the dry form of the disease, especially geographic atrophy, an advanced stage of dry AMD. Medications like pegcetacoplan and avacincaptad pegol have shown promise in slowing retinal atrophy by inhibiting inflammatory pathways. These are administered through eye injections every 1 to 2 months and have been shown to slow disease progression by about 30 to 36%. Research continues into innovative therapies such as stem cell treatments, gene therapy, and anti-inflammatory drugs. While these are not yet standard care, they offer hope for future options to repair or replace damaged retinal cells. Ultimately, the best approach depends on your specific condition, stage, and overall health. Regular checkups with a retina specialist are essential for monitoring progression and tailoring treatment plans. Early intervention and consistent follow-up can make a significant difference in maintaining your quality of life and preserving your vision. Always consult your healthcare provider to determine the most appropriate treatment for your individual needs.